Next question is, how do we detect colorectal cancer? There are two ways of detection. Number one is by symptoms, which is more common in our part of the world, which means that if you have any persistent symptoms, any unusual symptoms, those symptoms that we have discussed earlier, see your doctor, and the doctor would arrange a couple of tests based on the symptoms. If the symptom is, if you are passing blood in the stools, one of the initial simple tests is to send the stool sample to the lab to see whether there is any blood proven in the test, or if you have any abnormal bowel habit as well, you can use that test. But then that test is not confirmatory. The only confirmatory test for colorectal cancer is by putting a camera from the back passage and to look at the whole part of the colon, from the left-sided, from the rectum to sigmoid colon to the left-sided colon, transverse colon, and right-sided colon, and be satisfied that there's no tumor, either big or small, is growing inside. So the only confirmatory way to know whether you have colorectal cancer or not is by doing the camera test, what we call as a colonoscopy. And the other test that we tend to run in parallel with colonoscopy would be doing a blood test, doing a tumor marker test. At the same time, if it warrants a CT scan, then you would do a CT scan at the same time. You could imagine that if somebody has a plumbing issue, you need to look at the piping, the plumbing inside and also outside. So inside, you look at it by doing a colonoscopy, where you can visually, live, have a look at it. Any suspicious lesion, you can take a biopsy and send to the lab to confirm whether it is cancerous or not. And you have to look at it from the outside to make sure that you haven't missed anything outside from the colon. So that one is by symptoms. So any alarming symptoms, usually then you go for colonoscopy. The other way of detection is by screening. This is more abundant, or we tend to see more in developed countries, such as in the Europe or in America, where come to a certain age, based on the local policy, either 40 or age 50, age 40 with risk factors, then that would trigger a screening test. And the screening can be as simple as sending your stool sample to the lab once every 2-3 yearly, or subjecting the patient for colonoscopy. So in developed countries, the role of screening is more rapid, and I agree that we in Malaysia should emulate that as well.